Listen closely. There's one spot on your body that most men almost never think about. Yet, when you start giving it the right kind of attention, it can help you regain a level of confidence you may feel you've lost for good. I'm not talking about your penis. And no, this isn't about doing some complicated workout or extreme routine. I'm talking about a small, often ignored area that has a surprising amount of influence over your blood flow, your sensitivity, and yes, your ability to get and maintain a firm, reliable erection. I'm Dr. Eva Danial, urology and men's health expert. Quick heads up before we begin. I've shared the 2 natural supplements I personally recommend for stronger erections and stamina in the comments. They're genuinely effective, and I'll explain why toward the end of this video. Stay with me, because what I'm about to share can change the way your body responds, especially after 50. Here's the honest truth about what happens to many men as they age. And trust me, it's not your fault. Erections are a team effort involving your brain, blood vessels, nerves, hormones, and pelvic floor. In your 20s and 30s, that teamwork is smooth and automatic. But after 50, things can slow down. Your blood vessels become stiffer and less responsive. They don't open as quickly, which means the blood you need for a firm erection takes longer to arrive, and it's harder to keep it there. Testosterone gradually dips year after year. You may not feel the change immediately, but your body definitely notices. Nerve endings responsible for pleasure become less sensitive, so what used to feel electric now feels just okay. And then there's your pelvic floor, the muscles that trap blood in the penis during arousal. With age, stress, and long hours of sitting, they can weaken or tighten in all the wrong ways. When they're not functioning well, you feel it. The good news? Your body is far more adaptable than you give it credit for. Even after 50, you can reawaken these systems and rebuild reliability. You don't need gimmicks or complicated routines. You need simple, consistent inputs, signals your body can respond to calmly and predictably. This is where a natural tool comes in: castor oil. Castor oil isn't a miracle cure, but it contains a unique fatty acid called ricinoleic acid that has been used for generations to soothe tissues. When used externally and thoughtfully, it calms irritation, softens tight areas, and supports healthier circulation. When massaged into the right place, it encourages blood flow, relaxes the pelvic muscles, and restores mind-body awareness in an area most men ignore until something goes wrong. The key spot here is your perineum, the soft area between your scrotum and anus. It might seem like an odd place to focus on, but just beneath that skin lies the mission control center for sexual performance. 2 important muscles, the bulbospongiosus and ischiocavernosus, run through this area. They push blood into the erectile tissue and help trap it there. Branches of the pudendal nerve deliver pleasure signals, and arteries that feed the penis pass close by. So this is not just skin. It's a control hub. When you massage castor oil into this region, you help tight muscles relax, you encourage blood vessels to open, and you wake up nerve pathways that may have quieted over the years due to tension, sitting, or stress. Men who struggle with soft morning erections or who lose firmness too quickly often benefit the most because you're improving the environment, not just the symptom. Here's how to do it tonight, safely and simply. Start with a clean, dry perineal area. Use pure cold-pressed castor oil with no added fragrances or chemicals. If you have sensitive skin, test a drop on your forearm first. Warm about 1 teaspoon of oil between your hands, or by placing the spoon in warm water for a minute, never hot. Find a comfortable position. Lying on your back with your knees bent works well. Place your warm, oiled fingers on the perineum and make slow circles about the size of a coin, along with gentle front-to-back strokes. Apply firm, steady pressure, but never anything sharp or painful. Keep your breathing slow and even. Inhale through your nose and soften your belly. Exhale longer than you inhale. This tells your nervous system to shift out of fight or flight and into a relaxed, receptive state. If you tend to clench in this area, think soften on the inhale. On the exhale, Add a subtle lift, like you're lightly stopping the flow of urine. This retrains your pelvic floor to relax and then engage properly. Continue for 2 to 3 minutes. Don't rush. Afterward, place a warm damp towel over the area for 10 to 15 minutes. Evening is ideal because your body is winding down, and this calm carries into sleep, a key part of hormone balance. Repeat most evenings for 2 to 4 weeks. Some men feel increased warmth, tingling, or a sense of aliveness in the pelvic region within days. Others take longer. Both are normal. With consistency, you may notice stronger morning erections, better staying power, and a confidence you haven't felt in years. This isn't a pill, it's retraining. You may also notice unexpected benefits, like improvement in lower back tension, better bladder control, or less pelvic heaviness. Everything in this region is connected. If anything feels uncomfortable, ease up. If you feel pain, numbness, or major changes in urination, see your clinician. Don't use castor oil on broken skin. It can stain fabrics, so use an old towel. Stay hydrated. Eat more leafy greens, beets, healthy fats, and foods that support nitric oxide. Move daily. Walk. Lift. Sleep deeply. Breathe slowly. Relaxation is just as important as strength. And if morning erections have been missing for months or firmness is unreliable, talk to your doctor about blood pressure, glucose, lipids, medications, sleep apnea, and testosterone. These matter. Think of this routine as an environment upgrade. Oil, slow circles, deep breathing, warmth, then rest. Give yourself 1 month. Watch for the small wins. They add up. Your body can heal at any age when you remove friction and give it the cues it needs. Now, let me close the loop on natural supports, because many men ask about them. Watermelon extract rich in L-citrulline helps nitric oxide and supports blood flow. A performance blend combining Icarian, tonkat ali, fenugreek, nettle root, and citrulline can support stamina, circulation, and testosterone as part of a healthy lifestyle. Remember, your sexual health is not just about performance. It's about connection, confidence, and feeling fully alive in your own body. When you take a few minutes each evening to care for this overlooked area, you're not only improving blood flow and muscle function, you're also rebuilding trust in your body. Many men tell me that this simple routine becomes a moment of grounding, calm, and self-awareness in a stressful day. Consistency is everything. Small improvements turn into bigger changes, and those shifts can help you show up more confidently in your relationships, your intimacy, and your overall well-being. Give yourself permission to invest in your body, because you deserve to feel strong, capable, and fully responsive at any age. As you continue this journey toward rebuilding strength, sexual vitality, and confidence, I want you to understand something deeply important. Progress in men's health is rarely linear. Some days you'll feel noticeable improvement, better fullness, quicker response, stronger morning wood, and other days may feel slower. That doesn't mean the routine isn't working. It simply means your body is recalibrating. Healing, especially in the delicate network of nerves, vessels, and muscles of the pelvic region, often happens gradually beneath the surface before it shows up as visible results. This is why consistency matters more than intensity. You don't need long or complicated routines. You need small, repeated signals that tell your body, this area matters. Wake up, heal, respond. Over time, these gentle cues reshape the way your pelvic floor functions, the way blood flows, and the way your nervous system reacts to arousal. Think of it like tuning an instrument. You're restoring harmony where things have slowly drifted out of sync. Another key factor many men overlook is stress chemistry. Chronic stress, whether from work, finances, relationships, or even silent internal pressure, directly interferes with erection quality. When the body stays in fight or flight mode, blood is pulled away from the pelvic region, muscles tighten, hormone balance becomes disrupted, testosterone dips, sleep becomes fragmented. Even the most physically healthy man will struggle under those conditions. That's why the slow breathing during the castor oil routine is more powerful than it seems. You're not just relaxing the muscles. You're signaling your nervous system to shift into a state where arousal is possible. This is also why strengthening emotional and physical connection with your partner can amplify your results. When intimacy becomes filled with pressure, expectation, or performance anxiety, the body's natural arousal pathways shut down. But when you approach intimacy with ease, curiosity, and presence, the body responds more freely. Many men find that once they begin improving pelvic circulation and muscle coordination, their confidence grows naturally, which further improves performance without effort. Another aspect worth mentioning is movement. Gentle hip mobility exercises, daily walking, and even light stretching of the inner thighs and lower back can dramatically support pelvic health. When your hips are tight or your lower back is inflamed, the pelvic floor often compensates by clenching. That tension reduces blood flow and makes erections less reliable. Adding 5 minutes of light hip circles, figure 4 stretches, or glute activation can reinforce everything you're accomplishing with a castor oil routine. Equally important is how you treat your body during the day. Long hours of sitting compress the nerves and vessels in the pelvic region. If you work at a desk, take a 2-minute break every hour. Stand, walk, stretch, or simply shift your weight. These micro-adjustments keep circulation alive and prevent numbness, tension, and stagnation. Hydration is another underestimated pillar of erection quality. When the body is even slightly dehydrated, blood becomes thicker and flows less efficiently. Aim for steady hydration throughout the day, not large amounts at once, but consistent small sips. Your blood vessels, nerves, and tissues all rely on fluid balance to function optimally. And let's talk briefly about food timing. Eating heavy, late-night meals forces your body into digestion mode when it should be in restoration mode. This disrupts testosterone release and reduces morning erection strength. Try shifting your last substantial meal earlier in the evening. Your hormones, sleep cycles, and vascular function will reward you. A surprising number of men also deal with hidden inflammation from processed foods, excessive sugar, or trans fats. These directly damage the endothelium, the delicate lining of your blood vessels that regulates erection quality. When you focus on whole foods, healthy fats, fiber, and nitrate-rich vegetables, your vascular health changes noticeably within weeks. Some men also benefit from mindfulness around stimulation and pornography habits. Excessive visual stimulation can desensitize the brain's reward circuits, making real-life arousal more difficult. Reducing screen-based stimulation, even slightly, often leads to stronger natural responses. As you continue this journey, remind yourself that your body is not working against you. It's simply responding to years of patterns, stress, and aging. But the incredible part is that it can adapt at any age. The combination of circulation support, pelvic floor retraining, breath work, nutrition, sleep, and natural supplements creates a comprehensive foundation for long-lasting improvement. This routine is not just about stronger erections. It's about restoring confidence, vitality, and connection to your own body. Over the next month, watch for subtle changes. Better warmth in the pelvic region, more consistent morning erections, slower arousal buildup, stronger response during intimacy, and a growing sense of internal ease. These are signs that your system is waking up again. Stay consistent, honor your body's pace. And remember, improvement is not only possible, it is expected when you give your body the right environment to thrive. Thank you for watching. I'll see you in the next video.